Alright, so today let's go into talking about a probably new treatment for Alzheimer's disease. So let's looking at this 76 years old grandfather from China who was diagnosed with late-stage Alzheimer before the treatment. So his condition was kind of severe, kind of critical. He wasn't able to recognize his loved ones and wasn't able to take care of himself for some basic daily tasks like eating, dressing, and go to the toilet, right? So basically, he was required for around-the-clock care, and the caregiver described him like as of having incoherent speech and having severe cognitive deficits. So his life quality was kind of worse and unable to have meaningful interactions with loved ones. So then he underwent this groundbreaking treatment called LVA surgery. So basically, it's a 30 minutes neck surgery performed in China by Dr. Shin. So there is something remarkable happens. Just a few days after surgery, the grandfather was able to recognize his son, recognize his loved ones, recognize his families, and able to speak clearly, which is amazing, right? And with good care from his families, he was able to sitting, walking, and standing, and for some basic daily tasks, he can do it by himself after 6 months, right? And by the 8 months after the surgery, he was able to walking without any assistance and even seeing. By the way, this is videos. This is a video cutting. This is some screenshots cutting from the video, and I will put the whole video, the link of the whole video down below at the description bar or at the top corner, here or there, okay? So, by the 8 months, he was able to have meaningful interactions, have joyful engagement with his families, which is really touching. So let me explain why and how these enormous changes happen. So let's imagine our brain like your neighborhood. So for instance, my house, and we produce rubbish, right? We produce trash in our everyday life. And when the trash accumulates, we will I will just take it out in front of my house, right? Or maybe take it on the street. And late in the night or early in the morning, there will be someone driving this truck to collecting all the trash. And then go to some place like here for recycling or just burning it out, right? So what if one day the truck didn't come, or maybe the street has been blocked, right? So you can imagine that the trash will quickly piles up like this in front of my house, not only in front of my house, but in the whole neighborhood, right? So this scenario precisely illustrates what happens in Alzheimer's disease and other dementias. So our brains functions the whole day, right? And it also will produce like all kinds of trash. In our brain, it's all kinds of toxic wasted protein and all kinds of byproducts. Our brain also has its own cleaning system. So if the cleaning system of the brain getting blockage like this, so all kinds of toxic protein and all kinds of byproducts of our brain will be piled up inside it and eventually causing all kinds of dementias, right? So let's have a look what it is. So this is our brain's cleaning system. So all this stuff is just discovered by these decades. By 2012, Danish scientists discovered there was lymphatics. Pretty tiny, right? So these, by the way, this system only function when we sleep. So that's why sleep is so important, right? So this is just like a shower to flush us out the waste out of your brain when we sleep. And in 2015, the researchers from University of Virginia discovered there is meningeal lymphatics in our brain. The function of meningeal lymphatics is like to draining the waste from here down to our neck, the lymphatics of our neck. So the Dr. Shin from China realized that the blockage of our brain's cleaning system resembles lymphedema. Lymphedema is a common situation that treated by a surgery called LVA, which is just to reconnect the lymph channel in our legs or in our arms, in our legs, right? So Dr. Shin realized that the blockage of our brain causes all kinds of dementias, just like the lymphedema in other part of the body. So he started to thinking, why not apply this surgery, LVA surgery, on our neck to connect our neck's lymphatic channels to the nearby veins. And it has been proved this truly matters. By 2022, Dr. Shin alone has performed 200 of these kind of surgeries and still having 20 procedures each month right now. And in China, across China, there have been 1,000 patients with Alzheimer and other kinds of dementias have been taking this surgery, have been getting somewhat kind of improvements.
But it's important to be cautiously optimistic that this surgery is groundbreaking but still in development. We cannot yet guarantee it as a definitive cure of Alzheimer's disease. However, the observed improvements in patients' cognitive functions, independence, and overall qualities of life are undeniably significant. And clinical scales and patient outcomes constantly reflect these encouraging results. Also, this pioneering approach is expanding, with ongoing researches and upcoming trials at respected institutions globally, including Cleveland Clinic. Researchers are actively working to conform and refine these treatment methods, aiming to make it widely accessible. So the future of Alzheimer's care looks promising, and ongoing advantages will likely bring even greater breakthroughs soon. Families now have genuine reason for hope. And if you or a loved one is dealing with Alzheimer or other cognitive conditions, please reach out to our dedicated team to consult with Dr. Shin. We are here to answer your questions, provide information, and discuss about how this innovative treatment might help. So together, we can move towards a brighter, healthier future. Thank you for watching, and remember, hope is closer than ever.